All right, today is March 25th, 2020. We're going to go through the Doffing procedure for the Anesthesia Lahey department. This is based on our current supplies and our current recommendations for COVID-19 patients. I'll play the role as a clean observer, and Tomas will be the person doffing. A couple things about the clean observer roles. If there's an ante-room, okay, the ICU has 4 ante-rooms, all the doffing will occur in the ante-room. If there's no ante-room, like on the floor or the ER, the only thing you should leave the room with on you is the N95 mask, the ortho helmet, and a pair of gloves. Everything else is taken off in the room. Also of importance is the size of the receptacle that you're throwing your contaminated garments in. Some of them are smaller, so you need more than one. Some may have lids. Get that lid off before you do so you don't contaminate yourself. So we're going to do this as if there is no ante-room, because that's the easiest, more complex situation to go through, okay? So the first thing we're going to do before we do anything, after we intubate the patient, we're going to disinfect our outer gloves. So you can Okay, the next step we're going to do is make eye contact with a clean person. They may or may not be in the room, so they're going to observe you doing all these steps, and maintaining eye contact is very important. You have already identified your prearranged disposal bin, and we're going to go from there. So the first step after you've decontaminated your gloves in the room is going to be the removal of the ortho hood. It's going to be from the back forward. Good. And we'll put that in the bin. Of note, it's important that you have headgear on this at this time, because the ortho helmet, or you can contaminate yourself and bring it over, so it's very important that we have our headgear on, or cover on that point. After we remove the ortho hood, the next step is to disinfect the outer glove again. The next step in the process is going to be the simultaneous removal of the gown and the outer gloves. For demonstration purposes, we're going to untie it in the back because we don't want to rip it. But it's going to be a pull from the hips, just like in the MH video, MGH video, yep. Down our arms. Just pull it. Good. And you go down one arm, taking both the gown and the outer glove with it. Great. And then we go to the next arm, taking the gown and the outer glove with it, and we'll dispose of it in the pre-designated bin. The next step is to disinfect our inner gloves. The next step will be to remove our shoe covers. You can use a chair or you can stand, whatever is easiest for you. After we remove our shoe covers, we will disinfect the inner glove again. At this point, if there is no ante-room, you are okay to leave the room that you've intubated the patient. So again, when we're leaving, we just have the ortho helmet, N95, and outer glove. When we come out of the room, the first thing we're going to do is remove our inner glove. And you can use a pinching method with your index and thumb and pull forward. Yep. You can do it on top of the glove. Here, or under it, yeah. Now we would disinfect our hands again after the removal of the inner glove. And we would put on another pair of gloves. Sometimes If you wear a medium-sized glove, upgrade to a large here because you have so much alcohol on your hands, it's very hard to get the glove on again. We'll also probably have a lot of sweat from having been on there. Next step is for the clean person to remove the ortho hood. We'll remove this and set aside for decontamination with whatever products necessary. The next step would be the removal of the N95 mask, head cover, and outer face mask if you're wearing one. After removing our N95 mask, head cover, we will disinfect our gloves again. We will remove the gloves. We'll then disinfect our hands once more. Optionally, depending on the provider, you could change your scrubs per some recommendations. And don't forget to clean the ortho headset with approved cleaning solution. The resources again used for the doffing were the MGH video, the John Hopkins Ebola doffing video, anesthesiology special section on perioperative management on patients infected with the novel coronavirus, and also the CDC guidelines. Thank you.